Our laws as it pertains to substances are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for Christ's sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want help stop it, I can help. I got a lot to say. I got a lot more to say. Hey everybody, welcome. I'm watching you out on Restream, and of course I'm not on Clubhouse today. We've had a couple little technical challenges, so here we are from New York, much like I promised, taking the Wheel of Fortune on the road to Orlando or wherever. And we've been really on the road. We've been with our comedy friends in Austin, and I was hoping to get Susan on the horn here, but you can't talk, right? Your microphone doesn't work, Susan?
What?
You can. She's about a foot away from me, and she was like, "What? Huh? What? Are you able to speak on mic, or is that just a
Yeah,
no?
I can talk. I was just listening on Twitch because I don't have sound.
I don't have return either, but it's all right. We're with a little technical stuff, but it's all good.
You don't have return?
It's all right. I don't need it. I'm
Caleb,
all good.
talk to Drew.
Caleb here. I hear Caleb talks to me. I just
Okay,
don't hear you. I don't hear Mike.
Oh, you won't be able to hear me now.
All good. But we had a blast down in Orlando, did we not? With our friend Nikki Glazer and
we
Jimmy
did.
Oyang and Christina P.
Christina
and
P.
Andrew Santino and Bobby Lee. We saw everybody, all of our old friends.
Yeah, we saw our friends perform 4 nights in a row.
That was crazy.
And we were really full of comedy when we left.
And then
it was funny though. It was so funny.
And then of course I got another diverticulitis attack, which was awesome. And that knocked the wind out of my sails a little bit. So I'm trying to deal with that. But we still were out again last night with old friends. Yeah.
You said we were in Orlando. We were in Austin.
I know. The Caleb, help her out here a little bit. The Wheel of Fortune would always go on location in Orlando to be near to Disneyland or Universal Studios.
That's your favorite show, huh?
No, it's not my favorite show. It's the show that's the paradigm of going on the road. They'd go to Hawaii, they'd go to Orlando, and we're in New York, so that's where we are. So Caleb is cracking up in our, what's that? Yes, we're in Bermuda next week, but we will not be doing shows. We'll be doing the shows tomorrow and Thursday. We've got a bunch of stuff coming up. We have Adam Hounsley back in here tomorrow, and we have, I don't know what's going on Thursday. Do you know what's up on Thursday?
Yeah, we have something.
We have something up on Thursday. Thank you. That helps me out a lot. But today we have Dr. Khashayar Hematpour. I hope I get that right. Assistant Professor of Cardiac Electrophysiology at McGovern Medical School, UT Health Houston, also an electrophysiologist at Memorial Hermann Heart and Valve Institute. Dr. Hematpour, did I get the name pronounced correctly? I'm so sorry.
You got it right. It's Kash Hematpour. I go by Dr. Kash.
Kash Hematpour. There we go. Yeah. All right. So the reason we're having this conversation today, and let me monitor you guys on Restream, since that's my only connection to the outside world. We don't have Clubhouse today. One of the things, there are 2 big topics I wanted to get into. One was people have a lot of, in fact, I have a little bit of confusion about what happened to poor Gilbert Gottfried. As always, medical reporting by journalists is woefully inadequate and confusing and sort of pathetic. In this case, what has been reported is that he died of ventricular tachycardia, which is a singularly treatable arrhythmia by many means. Back in my day, we didn't necessarily have the implantable defibrillators that work so well. We had antiarrhythmics that were pretty effective against things like wide complex tachycardias, like ventricular tachycardia. But do you know what happened in the case of Gilbert Gottfried?
Well, Dr. Drew, thanks for having me. This is very interesting because the information out there is very limited regarding Mr. Gottfried. In general, you're right. Ventricular tachycardia, especially if you predict that it's going to happen in a patient or person, it's very predictable and you can treat it. But in his case, I don't have sufficient information to comment on how it was treated. But generally speaking, it's an arrhythmia that compromises the blood flow to the body. So the person who's affected by this arrhythmia either feels very bad or passes out, and it can be lethal. So the ways to prevent it is, for example, by implanting a cardiac device named a defibrillator. So if that person goes into that arrhythmia, it'll treat it with an electric shock and resets the heart back into rhythm.
Right. And there are antiarrhythmics, so to speak, that change the
Absolutely.
electrophysiology of the electrical system that can keep the whole thing calmed down. But I'm right now, as we're talking, reading about, he had apparently myotonic dystrophy, and I only have seen a few cases of myotonic dystrophy in my time,
Very
and
true.
essentially, as I recall, yeah, myotonic dystrophy is a condition where you constrict your muscles, you contract muscle, and it stays contract. You can't relax it. And apparently that doesn't just happen to skeletal muscle, it happens to cardiac muscle as well. So I'm guessing what I don't see here is that it affects the health of the muscle in any way. In other words, does he develop a cardiomyopathy, and is that really what took him? Or is there
Correct.
something about the kinds of electrophysiological changes that these guys have that makes it recalcitrant, which I've never heard of? It seems like these days, I'm sure there is such a thing, but these days we have such good treatment of electrophysiological problems. That's where I get confused.
Correct. Correct. So this muscular dystrophy is basically a genetic disease that causes a mutation in a gene named DMPK, which appears that the protein produced by this gene has a role. So basically, if the gene is defective, what happens is that you have intermittent episodes of, as you mentioned, tensing of the muscles with weakness of the muscles. So heart is a muscle basically. So it affects that in same fashion. So whether or not a ventricular tachycardia was, caught him off guard, or it was, predictable, and it was going through stages of little and small episodes of ventricular tachycardia, that's unknown to me. But
Mm.
yes, the first step is always medication. We have few medicines. They are okay treatments. Basically, they are rhythm stabilizers. They stabilize the transport of ions across the cell membrane, like sodium and potassium, and stabilize the heart muscle to some extent. But the bottom line is ventricular tachycardia is lethal. So if we detect that in someone, um, usually medicines are the first step, but we tend to have a very low threshold for treating them with more aggressive, sort of speak, management strategies like defibrillators or ablations, which are procedures potentially can fix this rhythm.
Yeah, it's so odd that this took poor Gilbert. I just feel like there's, of course, he's entitled to the confidentiality of his healthcare, but there's just so much missing information. And again, the cases of myotonic dystrophy that I've seen, the heatic problem. So I just, the whole thing is just kind of mysterious. But so be it. It certainly didn't. It seemed to impair his cognition. That's for sure. He could not have been a smarter guy. Well, anyway, it's we'll have to just continue to scratch our heads about this. The other topic I wanted to get into was POTS syndrome, and this may get a little more complicated because I've seen a ton. I suspect it's not specifically what you're dealing with, but I don't know if you do tilt table studies and that kind of thing in addition to your electrophysiological work, but I'm guessing you still come across it a fair amount these days.
That's correct. So as you mentioned, the POTS is very common. Very common. It's not a dangerous condition to have, but it can be quite debilitating. So basically, the person that's affected of POTS, you can't find any major structural problem with the heart. But the fact that the heart constantly runs rapidly, even when they're sitting down, relaxing, or watching TV, with a heart rate of 130, 140, which is quite high, that's debilitating, and management of it is difficult. The reason is, the problem with POTS is not a disease. Basically, it's an exaggeration of your normal body response. Let me explain. For example, if you remove a heart from the body, and human heart, put it on the table, it will start to pump faster, to beat faster. That's what the nature of heart muscle is. So in the body, brain is constantly uh, telling the heart that slow down, and it does it by a few means. One of them is a nerve that's called vagus nerve, and constantly tries to slow down the heart. So in a lot of times in young people, this balance is off. What I tell my patients is that it's as if you're driving a fast car, like a Ferrari. You push on the gas, and your car just takes off, and that's what's causing the symptom. Unfortunately, we don't know what's the underlying reason why it happens, but we know that the balance between the brain and the heart is off.
Well, I've seen a lot of it from COVID, and to a lesser extent from the vaccine. And I'm wondering if you were being asked to evaluate those cases.
Yeah, definitely. So, from after COVID, one of the first things that we noted was that people will come in several months later and constantly complain of a rapid and fast heartbeat without any other signs or symptoms of a major structural heart disease. And so we noted that, yes, incidence of POTS dramatically increases in people who contracted COVID sometime in the past. Why it happens, we don't know. Treatments are limited. Medications help to some extent. But again, since it's an exaggeration of a natural body response and reflex, it's difficult to treat. Seems like time helps. Other things that may help are exercises, aerobic exercise, or daily aerobic exercises, 5 to 6 days per week, and remaining hydrated and taking medications.
Excuse me. Do we know what it is about COVID that's precipitating this? Because the other thing I'm seeing, and I have two questions. A, do we know how COVID is doing this? And B, I'm seeing a lot of syncope also, sort of unexplained syncope with POTS-like syndrome symptoms. Is that usually part of POTS?
That can be part of POTS. Yes, that is correct.
Yeah.
As far as why COVID causes this, we don't know. What we know, and again, I'm not a neurologist, but what we know, it can affect your nerves in a permanent fashion. Basically, if you do a biopsy of the nerves, or, for example, autopsy of a victim of COVID, you would see in certain areas of the brain, or even the nerves, the tissue is smaller, is thinner. So, and that indicates that there is some sort of cell death that happens in those areas.
Well,
but as far as
a lot is being made of that by the pediatricians, particularly the virologists, and I would push back on that a little bit, because you look at anybody's brain after a severe illness, and particularly older people, they have loss of glial cell, they have loss of volume, and they get it back. And so I don't know. There's a lot being made of that, and it's mostly the pediatricians who don't deal with adult neurology that I've spoken to that bring it up. And I bet we're going to see data soon that show there's restoration of the predominant changes associated post-COVID. But we started with Gilbert Gottfried, and I'm of the opinion that what happened to Bob Saget was POTS syndrome. I know it happened to my friend Heather McDonald. She had the exact same fall and fractured her skull and had a subdural hematoma. Fortunately, hers happened on stage, and so she was taken right off to the hospital. But it makes perfect sense to me that Saget had POTS, didn't really know it, passed out, hit his head, got up in a daze, laid back down, and the bleed progressed, and that was that. How do you like my theory?
It is very plausible. Unfortunately, I don't know the specifics of Mr. Saget's, unfortunate event, but it's very plausible because syncope or passing out is a known symptom or side effect of POTS.
Yeah,
it's mostly because of a sudden drop. At the same time, your heart rate starts to go faster and faster. What causes it?
Exactly.
Again, is the imbalance between the nerve and the heart.
Exactly. Yeah, it's a really interesting thing, and I have seen it, I'm sure, from the vaccine too. But it's something about this spike protein. It is the strangest thing, and I don't know what we're gonna figure out. Thankfully, in the vast majority of cases, it is all transient and all gets better, and people are fine ultimately as long as they don't fall and hit their head. The other thing, maybe I don't know how much syncope or so-called fainting or passing out you're seeing, but this phenomenon of complete collapse and flipping the head back and striking the occiput is one of the things that caught my eye in what we're seeing around POTS, at least witnessed POTS. I'm when my elderly patients faint, the hands go up and they go forward. This is a down and flipping of the head back, and as though blood pressure goes to zero suddenly. And that's a peculiar thing. I'd only seen that a few other times. I've seen it with sudden cardiac death with coronary disease, where they just gone, and then there's sort of a collapsing backwards. But normally, blood pressure when people pass out has a tendency to it dips, or it doesn't go to zero all of a sudden. Am I on to anything with that, do you think?
Yes. Here is what I tell my patients, as it seems like it's all I'm talking about all day is arrhythmias. So they ask me, for example, the doctor, what happens if I don't for example, I don't get this pacemaker and my heart rate is low. So
Right.
I tell them passing out as a result of a heart problem, or in medical terms, cardiac syncope, is the worst type of syncope. The reason is you don't have time. Most of the time. For example, if someone passes out as a result of seizure or some problem in the brain, a lot of times
they feel funny.
They feel funny. They have time to pull over, do something about it. But this is like bam,
bam,
drops,
that's right.
They fall.
That's right. Yeah, I totally. And now that I've seen so much POTS, I've seen witnessed syncope that has in young people, and it's been different. The quality of the fall has been different, and so thank you for clarifying that. That caught my eye. The other thing. So I wanted to tell you a case real quick. I was in my office the other day, and this 80-year-old woman came in. She said, "I've been seeing the ophthalmologist for the last 4 weeks because in my right eye, there's this bright rim of light that keeps pulsating." And she did this. She was doing this with her hand. And I said, "Huh." And they go, "What do they think it is?" "Oh, they think it's my retina. They don't think it's anything, blah, blah, blah." And I took her pulse and it was 30. And I said, I hope it is just, that it's trigeminy or something, and I'm only feeling the pulse at 30. So I hooked her up, lo and behold, complete heart block. And she's walking around feeling fine. which I had never seen before. And I called the cardiologist, and he said, send her in this afternoon, and she's the caretaker for an elderly husband with dementia and Parkinson's, and it was she refused to go to the hospital, and she did just fine. They put the pacer in 4 days later, and no problem. Is heart block, which is something that the last time I saw heart block, a guy got it on the freeway and he called me confused, and I just was like, stop, get an ambulance, do not pass go. This idea that somebody with a heart rate of 30 and a completely disorganized, blocked AV node is walking around. Does that happen very often?
It does. And what it means is that it has happened more so in a gradual fashion. So your body has compensated to that by increasing the blood pressure. If you have low blood pressure in complete heart block or significant slow heart rate, then that's bad. That means that all your mechanisms of compensating for this are gone. But the way I see the patients in my clinic are mostly in that fashion. They are sitting, they say, I just have some vague symptoms, maybe a little dizziness, but I'm fine. When you check it, the heart rate is in the 30s. You mentioned something very interesting, which I think it's very good for people to know, because oftentimes I get people in the office, they say, doctor, I have a skipped beat. Like I check my pulse and I don't feel a big beat, it skips. What actually is what we call PVC, or you mentioned bigeminy or trigeminy, which means there is a beat, but it is so premature and early that the heart muscle doesn't have time to fill up and generate that forward flow in your circulation to generate enough pulse for you to feel it. So basically, it's not too slow. It's just premature beats, which it has its own treatments. If you have premature beats, vary, and some of them are harmless, some of them can be very dangerous. If you get a lot of premature heartbeats back to back, then you can call that ventricular tachycardia. Basically, ventricular tachycardia is nothing more than a lot of back-to-back premature heartbeats that compromise your blood flow.
I see a lot of people with ventricular parasystoles and PVCs and things, and they get very upset about the compensatory pause. That's what people complain about. So talk to them about that.
Yeah. So when you get a premature heartbeat, so let me go back a little bit and explain a little bit about the heart anatomy. Human heart has 4 chambers. There are 2 chambers up top, which are called atria, and 2 chambers at the bottom. The top chambers work as storage for blood and also drive the rhythm. The bottom chambers are the main engine. They are thick muscular structures that generate the forward flow force. So our heart has an electrical system, which is literally like wires in your house. The little wires run in the heart muscle, and what they do, they transmit the electrical signals in a certain fashion to keep the sequence of beating the way it should be. The sequence is the top chambers squeeze first, and then they push the blood into the bottom chambers. Then there is this AV node in the middle of the heart, which works as an electrical resistance. Literally, it causes some delay, giving those bottom muscular structures some time to fill up with blood. And then through 2 wires, what we call right bundle and left bundle, the electrical stimulation distributes very quickly in the inner surface of the heart and makes the bottom chamber squeeze. So bear that in mind. Any disruption in this cycle will compromise the blood flow. When you get a premature heartbeat from the bottom chamber, that electrical activity transmits back to the top chambers and sort of speak stuns your natural pacemaker, which is in the top right chamber or the sinus node. So it skips for 1 beat, basically.
And having as somebody myself, so I've had PVC since I was 24. And what you feel is your body has to maintain the blood pressure when you get that compensatory pause. And some people get this feeling of like almost catching their breath or a little bit of adrenaline surge. And that's just your body kind of keeping things cool. But I see people's anxiety go up, and some of it is actually that higher circulating catecholamines that I personally have experienced. So you feel it. I almost feel my glands. I can just feel it getting into the system, and then people panic on top of that. That's how they get very upset about it.
That's true. Let me tell you about this. And I hope I am not confusing the audience, because it's really hard to explain some of these concepts of electrical system. But usually, the younger you are, you feel the symptoms of the PVC more. So the reason is because we humans have some receptors called baroreceptors in the arteries in the neck, in the carotid arteries. So they are very, very sensitive to blood pressure. When we get a premature heartbeat, the blood, sort of speak, backflows and leaks up in the neck, and in a premature fashion, and those baroreceptors sense that. On top of that, sometimes the premature beat makes the heartbeat against a closed valve. That's what makes you feel the fullness in the neck, and that can be really, really, annoying sensation for people who have it. It's very common condition. It's usually harmless. It really matters how many extra heartbeats you have per day. This is what I tell my patients, because nowadays, especially with all these watches and gadgets and everyone, they come to the office, they have their apps, their cell phone, they keep good record of it, and that's very good. Initially, we as medical community, we didn't know what to do with it, and we were like, okay, we shouldn't trust these things. But now we have learned that it gives you an amazing information. You just have to take time and delve and dig into it. So a lot of people do have extra heartbeats. It's not necessarily a disease. A human heart is not like a machine. So it is allowed to stumble every once in a while. So it really matters how much it makes you feel bad and how many do you get per day. If you get, for example, these are just rough numbers. If you get 120, 200 beats, extra beats per day, this is not within the range of being dangerous. And you will be surprised as what's the danger zone in this aspect. A human heart beats almost 100,000 beats per day, between 80 to 100,000. The danger zone is once you have more than 10,000 extra beats per day, which means 1 out of 10, which is quite a lot. More than 20,000, it is really dangerous and needs workup and advanced management. But below 10,000, we can just watch it, treat it with medications, and so on and so forth.
Just out of curiosity, let's say it is 20 or 30,000 and you do a complete workup, the muscle is fine, the coronaries are clean. Can you leave that alone, given a healthy muscle?
That's one of the options, although that's not what we recommend. If you want to leave it alone, that's fine. You just need to do an ultrasound of the heart muscle, echocardiogram, every 6 months to make sure, because the real concern is these extra beats will affect the ventricles or the bottom chambers and, sort of speak, will make them weak. So if you don't want to do any aggressive management, which some people don't, they they'd rather not go through any procedures. Then you can just follow them, do what we call watchful waiting, and do an echocardiogram every 6 months. Once you
Yeah.
see any drop in the heart function, then you will proceed with aggressive measures.
I have a question I don't know that I ever learned the answer to. And we were talking about the wiring system. So, the heart, essentially, the two chamber, it goes like that into this one thing, and then there's two wires going down, and then around the outside. Around the outside, everybody. And the septum depolarizes first, and then the ventricles follow. And when we read an EKG, we are watching this system. That's what we're interpreting, that electricity moving through the heart muscle. And we're also interpreting the rhythm that's what we've been talking about here. That's what an EKG essentially is. So we deduce muscular abnormalities or changes in the muscular health or the blood supply to the muscle, and we evaluate or break down the rhythms. Why does the wiring we're talking about that goes through the ventricles is called the Purkinje system? Why does that age before the rest of the heart? I've always wondered that. Does there anybody know why?
That is a very good point. Well, it seems like in human body, this is my theory. Whatever structure works more or harder ages sooner. So, for example, the bottleneck of the human heart is the arteries, vasculature, because they're in constant tension. I think the same rule applies for your conduction system, because they are constantly conducting electrical signals much faster than the rest of the heart muscle. That may be a reason why they age, quickly.
Got it. And are there other things you're worrying about these days? Are there other things of interest? I mean, obviously you're seeing the full spectrum of electrophysiological challenges, but are there things that you think people should be especially aware of?
Well, the one thing that comes to my attention in particular, especially after the pandemic, is that we are seeing a lot of late phase arrhythmias, which means someone got COVID, they recovered just fine, no issues afterwards, and then they come, 2-3 months down the road with this arrhythmia, which most often that we've seen is atrial fibrillation, the irregular beating of the top chambers of the heart. And
interesting.
That has become, more common these days. It appears that the inflammation caused by the virus, in the sac covering the heart, or in some instances, inflammation of the heart muscle itself, leads to this type of arrhythmias. So that is a concern. I've seen that quite a bit. Just to be fair, I have seen it a couple of times. After someone did have a reaction to the vaccine as well, which we know it's the same type of reaction as if you did have the disease. So yes, that is my concern.
You know what I'm seeing? I'm seeing a lot of supraventricular arrhythmias around occult, small, multiple pulmonary emboli, which is, I think, much more common than people understood from COVID. This is an endovascular disease, right? It affects the lining of our arteries and the relationship of the arteries to the platelets and the clotting system. I have seen an uncanny amount of pulmonary vascular occlusion, small. And oftentimes those guys come in later with rhythm problems. It's kind of interesting. I wonder if some of that is what you're saying. Or I wonder if we'll ever get to the point where we'll be doing, scans, PE scans on people when they come in with supraventricular rhythm disturbances.
That is correct. And unfortunately, it's a problem. We know the spike protein does some odd things in the body. One of them is it promotes blood clot formation, and that's in the realm of the same, and in the same spectrum of things that it does to the body, and we don't
Hmm.
exactly know how it happens.
Yeah, it's crazy. It's very interesting. So, what's the course of atrial fib when you see it? Let's assume you don't know whether there's a PE or not. They come in 3 months later with atrial fib. You're anticoagulating them. Do you go to convert them? Do they convert on their own? Do they convert chemically? Do they convert electrically? What's the usual course, or is there a usual course?
There is a usual course. Traditionally, first thing you do is you give people medications and electrically cardiovert them and watch them and see what happens. Especially if it happens as a result of something that you can see, it will be reversible. That's the first thing to do. And the younger the person is, ironically, you are more excited about fixing it permanently
Mm.
and quickly with not just the medication, with the treatment strategies that we do. They're invasive and it's called ablation. Going back to your question,
So these guys need. So these. Hey, I'm sorry to interrupt you, but these. So the post-COVID AFib needs ablation. Is that a common thing?
It is a very common thing because if you cardiovert someone and they keep coming back with a fib,
I get it.
and
Yeah, I'm surprised they do that, though. I'm surprised.
On medications that are potentially toxic, then yes. Yes.
I get. I thought you were going to say. I really thought you were going to say, well, we anticoagulate them. They chemically convert after a couple of months, and we let them go on their way. But you're telling me something very different. You're saying they persist, and you have to go all the way to ablation, which is
correct.
Do the ones you ablate? Do they have an myocardial disease of some type, or is it just some sort of weird electrical phenomenon?
Most likely they do, and it's hard to evaluate the myocardial disease, especially if it's very small. The best thing to do is to do an MRI, and it's not very easy test to get. It's cumbersome. It takes time. Not all centers do have. At UT Health Memorial Hermann in Houston, where I practice, we do have a good MRI division, and we occasionally send people. But the top chambers or atria have a very thin wall, so little streaks of fibrosis, which indicate the scar, are hard to detect by MRI. You can detect the scar in the bottom chambers very well with MRI, but in the top chambers, it is hard. But yeah, more likely than not, they do have some sort of permanent damage or scar or fibrosis in the chambers as a result of the virus. That's why they keep coming back.
Got it.
Arrhythmia.
Wow, we're learning more and more about this thing and all its protein manifestations all the time. So, Dr. Khashayar Hematpour, thank you so much for joining us. It's UT Houston, right? That's where you practice. I want to get the center right. And the McGovern Medical School at UT Health Houston. And do you want people to know your social media? Do you want to put anything else out there? Website?
Well, we do have a complex arrhythmia center in UT Houston, which we treat a wide range of arrhythmias. There is no arrhythmia that we don't tackle in this center. At times we are to the point that we have to figure out the next step without having enough evidence in the literature, basically. So we are very proud of it. We are a very busy center, and we like to, treat arrhythmias and help people.
Well, thank you so much for joining us. We appreciate it. And hopefully you and I can talk soon. It's Dr. Khashayar Hematpour. Thank you so much.
Thank you very much. Thanks for having me.
You betcha. And for those of you out on Restream, we're going to take a little break and come back in just a minute. and we're going to talk a little mask mandate. Be right back. Let me take a minute to tell you about Blue Mics. Over the 2 years we've been working with our friends at Blue Mics, the world has completely adapted to working and meeting virtually. So whether you know it or not, you probably spent a lot of time in front of a microphone. Take it from someone who has spent probably half my life on a microphone. Sounding good is extremely important. And because of Blue Mics, I have never sounded better. But a good mic isn't just for broadcasting. Quality audio makes a big impact on whomever is listening on the other end, from coworkers to clients to friends. Clear sound can make all the difference. Thanks to Blue Mics, you don't need complicated or expensive equipment to get professional results. For simple plug-and-play setups, try Blue Mics Yeti series. It plugs right into your USB port on your computer. Need something more robust? Blue's got an entire line of professional XLR mics, like the Mouse or the Blueberry we use here in our studio, as well as the more compact Encore 300. I love it for clear quality sound when we travel. Bottom line, there is no excuse to be the one on the conference call who sounds like you're in a tunnel or underwater. I cannot say enough about Blue Mics, and once you try one, you will never go back. To take your audio to the next level, just go to drdrew.com/blue. That is drdrew.com/BLUE. Yep, and of course I've got my Blueberry right here. Wouldn't leave home without it. I love these Blue Mics. Also, I have gotten very addicted to their Ultimate Ears wireless headphones. Susan, I don't know how I got my hands on them. I tried to give them to Susan, but Corolla I guess gave them to me, and they are best in-ear earphone, wireless plugs I've ever had, earplugs. So let's talk a little bit about what's going on with the mask mandates. So there has been a federal judge who has shot down the government's on constitutional grounds the idea that the government can mandate masks on airlines, both in the airport and on airliners. And help me in Restream. Help me. Am I missing something? About masks that I just don't understand what people are thinking. I worry that I'm off base. We have two huge studies, one out of Denmark, one out of Bangladesh. The Bangladesh study, we reopened the data, handed it to an open data system, was reanalyzed, and the data on cloth masks is even worse than in the original publication. Cloth masks do not work. They do not work. They especially do not work on a mass basis. So what do we expect a cloth mask to do on an airplane? This is the part that I don't understand. So, okay, and please do criticize me if I'm missing something. I'm open to input. And so people then say, oh, why do surgeons wear masks? Surgeons wear masks so they don't spit bacteria into a surgical field. They are not wearing a mask to prevent viruses, which are transmitted through the respiratory tract, mouth and nose, from being spread. They are preventing the bacteria in their mouth from falling into a surgical field. That's why they wear a mask when they're doing surgery. Now, when we want to get occlusive protection against an infective agent, we wear an N95 mask. And guess what? N95s may afford individuals, you, me, any of us that choose to wear an N95, some degree of protection, some protection. Me wearing an N95 does not protect you. Me wearing a cloth mask does categorically nothing for you. Why are we worried about other people wearing masks? If you want to go on a plane and wear an N95, please do, by all means. But especially with us pulling the mask down to eat and drink, these viruses are extremely infectious, and instantly so. So the way we use the masks on plane and in airports doesn't even make sense. It never made sense. And so why are people saying that we are killing children? I literally saw somebody say that taking the masks off on airplane was another Sandy Hook. I'm so confused. Please tell me how that's possible data-wise. It just is not in the numbers. And you could argue, there are some, you could argue, let's say we all wore N95s, everybody, and wore them perfectly. You could argue that might slow the virus down a little bit. And I can accept that, even though the data does not suggest that that's true, because the virus does what it does, as we've talked about many times on this stream. It gets, the number of deaths is the same in Florida, the same in California, the same, no matter what the mask situation was, is the same. It was the same. Now, we have vaccines, we have therapeutics, we have all these great things to protect ourselves. We don't need darn pharmacological interventions, and they don't work. So why is there any consternation about it? Please, somebody tell me. And apparently there's a very, that's right, Kat Dunleavy saying that the air filtration systems in aircraft are extraordinarily good. Probably the best, other than outdoors, let's be fair, it's better outdoors, but one of the safest places you can be in is a plane from the standpoint of their airflow and their filtration system. I don't see any of our air filtration engineers on the thread right now. And George Clark is saying, masks have been so hammered in our brains for the past 2 years, it's going to take some time to let people cool off. But what have we done to people? What have we done? I see people on the streets of New York, outdoor, wearing paper masks. Wow. I mean, that's a zero utility behavior, zero. And I just worry that I'm missing something. And I just don't understand why people can't look at the data. And then I'm confused why people have any disagreement about this. That's equally confusing to me. And then, of course, there is the constitutional issue. Essentially what the judge was saying was that if there is going to be any sort of mask mandate, it would have to be done legislatively. And the CDC doesn't have the authority to do that. And God knows they have made horrible, terrible mistakes, as we've talked about many, many times throughout this pandemic. And us trusting them to make the right decision. They thankfully, that is the one organization, by the way, I have great faith in the CDC. They are looking at themselves. I would love news agencies and government officials to look back at some of the things they've said and some of their behavior and just don't even apologize. Just say, I learned something. I was too certain about it. Don't even say I was wrong. Just, we've learned something. I'll accept that. But no. We're just continuing forward. So I don't know how you guys feel about it. Let's see. Unifinity saying, just where I went, so I don't need to throw hands with some random freedom fighter. That's very funny. Only hospital workers need to wear masks in Sweden. That's interesting. I'm not sure. Masks on healthcare workers is kind of an interesting question. I mean, maybe we should wear them all the time anyway, because we're seeing, infectious agents around. But again, they don't really work. So we'd have to put the N95 on to protect ourselves, and we wouldn't be protecting our patients. So it should be up to us to make that decision. So there we go. George Clark says he smells people in the subway. All right, let me look at your comments here. What's the genetic testing that I recommend? It is color.com, COLOR, like the color green or the color blue. It's color.com. It's like $250 for a cheek swab test. Checks like the 30 most common DNA repair inefficiencies that are associated with cancer syndromes, BRCA, that kind of thing, Lynch, like me. And if you're positive, they give you as much time as you want with a geneticist, give you a huge readout on the genetics of the condition you've been detected, and they will test your first few relatives for $50. It's ridiculous. I don't know how they run a business. It's so good. As I've said before, yes, Aleve Green, color.com is correct. And 10 years ago, this would have been $20,000 to get this done. And now it's $250 with $50 for your first degree relatives. Is Margaret in here? She had a question about stuff. Maybe she wants to ask it on the stream. Legislative process takes too long, can be filibustered for a month. The CDC needs to have some emergency authority. Technotherial. CDC has tons of emergency authority, tons. This is just one area where it didn't seem to make sense and they were holding it back. That's all. CDC, public health. Follow Vinay Prasad, who I've interviewed several times on this stream. Follow his take. I used to listen to him before the pandemic because he was such a brilliant interpreter of oncological medical literature. He just could read the literature. Some people can penetrate. There are two kinds of penetrative readers in my world. One reads philosophy. I recommend The Partially Examined Life if you like that kind of stuff. The other is people that can read medical literature that is very complex and really penetrate and determine whether it's quality, what the weaknesses and strengths are, whether the statistical analysis was done properly or not. That is a certain skill. I can't do it the way Vinay Prasad did. I just can't. I can sort of get a sense of it, but it's like speaking a language fluently versus kind of understanding things. So he has been talking about the mask issue quite a bit lately, and about lockdowns, and these things are just, the data is just so obvious. It's just, and whenever you see data that looks a little more equivocal, then I would suggest you go look at his analysis of those studies as well, because they're all very, very weak studies. And so here we are, where the probability of dying of the flu is higher than dying of COVID right now in many cases, in many situations. And we are still behaving as though we don't have any treatment for COVID. The Shanghai lockdown, I don't know if you guys have been watching that. Shanghai is doing, to my eye, exactly what happened in Wuhan at the initial phases of the outbreak. And we had press in this country. This is where I got myself in trouble, is that I kept saying, thank you, Oliver Green, for Trash Tuesday. That was a fun podcast to do. But I got myself in trouble saying, watching the press go insane and having over-the-top opinions about something they know nothing about. And I, at the time, kept saying, shut up, shut up, shut up. Listen to the CDC, listen to Dr. Fauci. They will figure out and give us the recommendations of what we need to do. But no. The press demanded that we follow the policies of the Chinese Communist Party and do what was done in Wuhan, do some version of that, locking down with no evidence, no previous history in the history of medicine had anyone ever locked down healthy people. Do you remember this? Locking down healthy people. We proved it doesn't work. We had just a national experiment. It didn't work, but it had never been done before. I beg your pardon. It was done in the 12th century during a plague in Venice, and it was a catastrophe. It was the only time it was done. So it's just so weird to see them locking people down in Shanghai. Zero COVID is zero probability. Everyone knows that. And the idea, and the lockdown, again, we've gone over this many times, the idea of the lockdown came from a 14-year-old high school student. Her dad worked at a think tank, and he took her little her science experiment and turned into a model that the Bush White House turned into a potential pandemic policy. It was for local and school lockdowns for influenza. No one, again, ever contemplated a state the size of California locking down, or what that would do to people, or the tremendous unintended harm it would have. And it has. And of course, it was very predictable. Very predictable. That's what would happen. All right. Let's see what else you guys are thinking about here. Yeah. So my point is that I'm just wondering if I'm missing something, if there's something about that people are convinced that masks work. I don't know. Does COVID cause lung damage, or the second is just kind of sepsis independent of COVID? So, Tomas, you're asking a very complicated question. So, Omicron does not get into the lung tissue, the lung parenchyma, the air cells. The original alpha and delta infections did cause inflammation of those air cells, and they would fill with fluid. That's called adult respiratory distress syndrome, or ARDS. That was the dreaded complication. And that ARDS seemed to be linked to a cytokine activation, or what early on was called cytokine storm. That it's essentially an overactivation of the interleukins, particularly because things like tocilizumab works very well. There's another combination medication out there of a cytokine inhibitor, I'm going to tell you what it is in a second, but in critically ill patients, shown to be very effective. There was a publication a week or so ago that looked really good with this one. It's another interleukin inhibitor. Let's see if I can come up with it. Damn. Give me a second. Oh, there it is. Sabazabalin. There's the headline, if you can read it. Let's see. Whoop. No, shoot. All right. Give me a second here. I'm going to have you read the headline because I took a picture of it. I was so excited about it. There it is. Sabazabalin cuts death rate. Can you see that at all, Caleb? Are you able to see it on your end?
Kinda.
Cuts death rate in COVID-19. Yeah. How about
If you,
now? It's out of focus.
Text
now.
it to me. I'll put it on screen.
All right, good idea. There we go. Caleb, 1 second. I know this is always a good stream to be doing this. There we go. You put that up on the stream. So the Zabazabalin, that's right, the Libra green. So point being, so you were asking about the lung, does it damage the lung? And ARDS and cytokine activation does damage lungs, and it can scar the lungs down. Also, as we talked about with the cardiologist a few minutes ago, COVID is an endothelial disease. It's an endovascular disease. So the lining of our arteries get inflamed, for lack of a better way of saying it, or the inflammatory system gets involved in forming clots by interacting with the lining of our arteries, and that's why people are getting pulmonary emboli, and people are getting strokes, and people are getting heart attacks, and this to me, I think, may end up being the really harmful part of COVID. And so the lungs are damaged. So the vasculature of the lung is damaged that way. The airways are damaged through the ARDS and the cytokine activation, and the airways are damaged. In the case of Omicron is primarily in the airways. So there you go. All right. Oh, you guys with your mom's house, you're so clever. Touch my heart through the fence. There it is. Sabazabalin cuts COVID deaths. Trial stopped early due to efficacy. That's right. So people are going to start using that in the ICUs now. And it really was dramatic. When I read that study, it was like, 80% of cases were turned around and people that were looking like they were not going to make it. So there you go. So I think that's it. Caleb, are you good? Anything else I need to get into here?
Yes, I'm staying muted because these blue mics are so sensitive that you could probably hear the baby crying in the
they're
other
so
room.
good.
So they're way too sensitive. They're great.
Color to the afternoon.
Yeah.
Susan, come on out here. Let's see if Susan has anything to say before I wrap things up and see where you guys are on the restream. Can't people wear sandals in New York City in the summer? Yeah. So how's your New York trip going? You all happy out here? Susan? It's not a trick question.
Say what?
How is New York going for you? Are you happy here?
It's going okay.
Good.
I like it here.
Okay.
We had some good dinner so far and saw some friends but I'm a little peeved that my fancy Zoom sound thing didn't work today.
Yeah,
but
I know.
I'm buying a Roadcaster right now.
Okay, Roadcaster.
But then
did you find one?
B&H is closed for Passover.
So there is a famous
they're owned by
camera
Jews.
shop
I didn't know it was
within
owned by
3
Jews.
blocks of us here, and it's the craziest place I've ever seen in my whole life. It's like, I mean, just every piece of electronic camera equipment you've ever imagined in your entire life, and you have to order it online. It's so huge, they push people through like it's a Subway or something.
Yeah.
You
But
you have to order it online
till Sunday.
And then they push you to these stations where you get your thing, you pay your thing, you go to, and then you're out the door. That's it. B&H, that's right. Are they in other cities as well?
Yeah, they're everywhere.
Everywhere.
But
there you go.
I may not get it till Thursday, so it's just you're going to be flying solo.
All right. Well, this is okay. This is fine. Let's see what you guys.
I know, but I want to talk to Adam Housley. I have so many questions about.
So
Shanghai.
so Susan is very worked up about Shanghai, which I mentioned a few minutes ago. She thinks there's something that I'm saying. What is it about COVID that would cause somebody with what government would take an intervention that doesn't work with a goal that's impossible?
And then shut down.
Why would they do that?
The whole area and starve people. And, I mean, this is the Chinese way. I mean, they've been doing it for centuries.
But Susan thinks there's something more sinister going on. Adam Housley is sort of.
Here's what I think. We went through COVID once.
Yeah.
We saw that people were damaged by it, and then they just shut everything down, and then they don't let people leave their house, and they have little like dog drones walking down the street telling people to stay inside, and they're screaming for help out of their windows.
Well, and then we don't listen. And the press is so messed up. I don't even know what to believe and not believe.
No,
I don't even know what's real.
See,
and what's not. So who knows?
I think, and I don't. This is what I think. I think that the government's preparing them for the worst if there is a war or a takeover. Or they're trying to starve. I mean, there's a lot of stuff going on in the financial world too, as well. They're really shutting down.
Well, you forget
tech.
already. Somebody presented a theory to us at dinner last night that it was an attempt to tank commodity prices.
Right, but if you look at at Baba's stock or whatever, they're talking about how they're trying to stop all the live streaming and the tech stuff, and that's called censorship, everybody. I just want to let you know. And that's what they do in China. But I think there's another reason, and it could be related to Putin being right. You know, they're either going to fight against Putin or they're worried that
Susan gets a little conspiratorial more quickly than I do.
China and Russia
They're
have worked together over the years.
Right now, but they have worked together. It's true.
No, and then they also, of course, we know they want to take over Taiwan. So they don't want anybody to come out and fight. They're going to make everybody as weak as possible and let them know who's in charge. So whatever decision they make, the people have to go along with it. That's called communism. So I don't know. I'm just really curious. It worries me more because I can't imagine. We saw that interview with that doctor who said the only people that were dying from COVID were 80-year-olds that hadn't been vaccinated.
So we saw an interview with a Hong Kong doctor, and it was BBC. We watch BBC a lot because they tend to be accurate and not crazy. They interviewed a physician. He said, yeah, 50% of the population has this virus. It's very common. So far, out of something like 12 million cases, 1,000 deaths, all over the age of 80, unvaccinated, 100%. And the interviewer just abruptly ended the interview because it didn't quite paint the narrative they were looking for. But I just want all the millennials out there to know that communism has not worked ever.
Yes. And when the wall came down in Russia, it took a really long time for them to sort of recover from that, because to go from a communist country like China with so many people to turn them all to capitalists, it's a change of life. They're used to getting handouts and they live their lives accordingly.
So I'm going to send you down another path right now, Susan. And I want to get a read from you guys on the Restream. How many of you saw the controversy today over the Libs of TikTok site?
Wait, what? Say that again?
Me.
Yeah, okay, Caleb, me.
I can't hear him. So
There's a firestorm over Libs of TikTok. Did your mom expose you to that? Is that what happened, Caleb? Is that how you found out?
No, I follow Taylor, her articles that she writes. She's been from the old days. She's always been covering internet stuff, so I always pay attention.
Okay, so this woman at the Washington Post started covering this thing called Libs of TikTok, and she seemed to me accidentally doxed her.
Right.
And though was literally knocking on the doors of family members and friends for information about this woman that really, it looks to me, I don't know who she is, but maybe we'll find out more, but she just throws up videos that people put up. It's not
like crazy people doing
it's
funny, like super nutty liberal things.
It's like your mom's house. It's like your mom's house, except instead of cool guys, it's lib guys.
Yeah.
And things. And
I
now
saw
there's
that.
this huge
Then
controversy.
they took it down because it was dangerous or something, because she was showing dangerous thoughts.
They're saying, I think, I'm looking at you guys, hang on a second. Cyberbullying journalist, Taylor Lorenz is her name, that's right. She does it on purpose. Somebody's saying it was not an accident. Okay. Lorenz has a history of doxing. Okay. Yes, I saw her crying on NBC and MSNBC. She was crying. That's right.
Because she lost her Twitter page?
No, because somebody sort of doxed her, and so she freaked out when somebody did it to her. None of it is good. Mommy jeans high and tight, not an accident. But Caleb, what did you throw up on the screen there? What was that stock price?
That was Susan had mentioned something about Alibaba stock price. And so I had not actually realized how far it had tanked.
Going up in
they had a different problem. The owner of Alibaba got in conflict with the government, and really started threatening him. And so that was a whole thing.
I just remember when it was peaking.
A very different story.
But it was also, they were going to censor Facebook and anything. I think a lot of it might have been porn. They weren't allowed to,
Anybody have any opinion about what's the former CEO of Twitter? What's his name?
Jack.
Help me. Jack. What's his name? Jack.
Oh, let's
look it up. Anyway, the former CEO of Twitter has been critical of the board's treatment of Elon Musk, which also was another interesting thing
Jack
in the news
Dorsey.
lately. And Jack Dorsey, thank you. And again, to me, the Elon Musk story is another one of these stories where I'm like, what am I missing? What am I missing? This guy wants to buy a stock, put it up to a vote, stockholder vote. That's what you do. You have a proxy vote. See what's going on. See what people think. Oh yeah, Steve, it tells us Jack Ma. Jack Ma was the one that got in trouble with
Right.
Alibaba.
Well, I mean,
but this is Jack Dorsey, and Dorsey now is critical of the board, who seems out of their mind. They're doing things that seems illegal to me and are going to get them really sued. I don't. And then how does creating more free speech limit free speech? Listen, there is a bill in the California Assembly right now to try to prevent physicians from saying things that might be considered misinformation. And there was a very fine rebuttal by an attorney, a civil rights attorney in this chambers, who said essentially the way to combat misinformation is with information. Way to combat falsities is with truth. That's the way we've always done it. Anything else is unconstitutional. It just is. So I don't understand why Musk wanting more freedom would create less free speech. I just don't understand. I must be, I don't know, Susan, I'm old. I think it's official.
Yeah, but they're trying to kill off the old people who know more.
I'm trying to digest that statement.
It's communist.
But she's still in Shanghai.
They want to get rid of like anybody over 80 who might actually know what war is.
All right. Well, today's been an interesting little romp. We've done a lot of different things today. We did a little cardiology. Those of you who don't know, I was going to be a cardiologist. I was heading down that path, but got off into the psychiatric stuff pretty thoroughly and did not come back, though would have been probably more fun to practice cardiology than general medicine. But I got a great experience on the addiction and the psychiatric side that you just couldn't have any other way. And then we're talking about Shanghai, and we're talking about Jack Dorsey, and we're talking about COVID, and we're talking about mask mandates, a lot of different things today. Did Jack Barsky ever respond to come on the stream? Did we talk to Jack
Not
Barsky?
yet. No.
Not yet.
We're traveling.
We turned it on. We turned it over to our
Did you send the
brokers.
email to Michelle?
I think I did. I don't know. I thought I did. DATS. Look at you. But why do they want it? What's JC? JC, what are you saying? Why does who want what? And maybe we'll kind of wrap it up with that. Control is what Mommy Jeans is saying. Yeah, but why do people want control? I don't understand it. You would think I would have some wisdom on these issues, but I have confusion. Maybe it's just my wanting to stay naive, or the truth is too painful to me to look at, so I stay in my ignorance. I don't know. They want power because they don't have enough to do anything meaningful. People do love power. Okay, not a droll's here, buddy. We can relax now. And not a droll, we're just wrapping things up. We're just wrapping it up. Creating more free speech is limiting free speech is an idea that makes sense in the bizarre world we live in. Thank you, Terry. It's true. BC, I am pragmatic. And pragmatism is what science is, essentially. All right. I don't understand it either, but ultra-powerful people want control. Money doesn't mean anything. Yeah, what does it do for them? I don't, it's very odd. It's very confusing for me. And many of them aren't doing anything with their power, except, particularly in California, what we see them doing is just being empty receptacles that special interests pour their interest through. And they really have no particular beliefs of their own, it seems like. So, okay, it is Insanity, JC. Let's leave it at that. Thank you all for being here. We appreciate it very much. Thank you, Caleb, for producing today's show, and Susan and Caleb for troubleshooting for an hour and a half.
I want to fool around with it a little more, because I don't think this stupid Passover. What's wrong with people?
What's a little more?
Having to celebrate their religion
wait.
when you should be working.
Wait, quiet.
I don't think
Caleb's
we're going to
mom
get
might
it.
be listening.
I don't know if we're going to get it in time, but Caleb, let's see if we can.
You could probably find some other place that has it, right? No? You have to have B&H.
Amazon, but it'll come after as well.
We love B&H.
I have it delivered by Am. Yeah, I do. We do too. It's pretty. It's right here. It's like literally 2 blocks away.
I know,
I
and
couldn't
it's
believe how
closed
close
till
it was.
Sunday.
Yeah,
That's so weird.
yeah.
I know it's post-COVID. It's like everything's changed, and it's not the same.
The interesting thing, so B&H, I actually do respect them
This
for
worked
that
out fine.
reason.
You did a good job without me, and it's really good to be back.
B&H actually
But we will
shuts
be going
down
next
all
week,
sales on their website on Friday nights as well. That's how like dedicated they are to their religion. So
well, that is yes. You don't use electronic instruments if you're a.
They don't even take sales. Like you can't buy something Friday night and then have it
because you would have to use
later.
electronic. You'd having electronic
be
media
around
then.
them.
So Angela says,
Can't touch them.
famous scientists just came out with the idea that we need more stringent censorship of information. Next time we have a lethal pathogen. Oh boy. Crazy. All right, we'll sign this off. We'll see you tomorrow. Tomorrow we're going to be at a different time than today. We're going to be at 2 o'clock Pacific time, 5 o'clock Eastern, with our friend Adam Hounsley, and Susan's going to get into it with us. So we got to get this thing set up.
Well, we'll see. I mean, I'll listen on the other side, and
we got to get this set up so she can have a mic and earphones so you can hear.
yeah, I have to. Well, yeah.
What he says. So.
Come on, Caleb. Let's make this darn thing work.
All right, everybody. We will see you tomorrow.
I had a quick question. I was seeing this lovely girl for a couple months, and she gave me the green light to not pull out. She has IUD, baby. Anyways, I'm just wondering how those things work, and was I flirting with disaster, or were we good? Yeah, just wondering.
God,
Anyways, don't call me daddy, touch my camera through the fence, and keep those balls full of cum.
Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.